My name is Mohammed Concept. I'm from Sierra Leone, West Africa.
So Mohammed, tell me this. When you very first came in here, what was your major complaint?
My major complaint, I had quite a number of complaints, but one that was really major was that I had a very painful lower back, which made it very difficult for me to walk properly.
And then you had a pinched nerve in that back
I
too.
had pinched nerve. That was what eventually that was found out.
Right, and that made your leg hurt.
That made my leg hurt, and the one part of the body was very weak, and from the lower back straight down to the left leg.
Oh my gosh. And how long had this been going on?
Well, it had been going on for about 4 years, really. But it's really got aggravated when on my way to the US, I was coming to see my family there. But I think the long plane ride actually aggravated it.
Right, so all that sitting hours and hours.
Hours and hours on the plane.
And so you had pain from the very first thing in the morning, didn't you?
Very first thing in the morning when I got here, it was very, very painful.
All right. So now we've been doing spinal decompression therapy. And tell us about that.
Yeah, the spinal decompression therapy has been very helpful because I've been able to, most of the pain is gone now. I really can perform a lot of activities without feeling any pain.
Well, it almost sounds as though you would recommend spinal decompression to others.
Oh yes, of course. I can drive, I can walk, I can lie down, I can get up without pain, which was almost impossible initially. I wouldn't sit down and get up without holding something or without it being very, very painful. Got to triangle with this year, I realized that spinal decompression could do it without open back surgery, and I can recommend it to anybody.